Hello everybody, welcome once again to the second session at the Vitrolife Group Academy studio. On our next session we will talk about the fast and the glorious when it comes to warming and vitrification. I have two esteemed gentlemen here with me today. We have Dr. Juergen Liebermann, he's the Director of Laboratories at the Fertility Centres of Illinois, and also Professor Thomas Freour from the University of Nantes in France. And I'm going to pass it over to you guys. Dr. Liebermann has done a lot of research in fast vitrification, fast warming, and some validation of these work. And Professor Thomas Freour has done a lot of work in validation in his clinic. So, over to you.
Thank you very much. It's okay. Thanks for coming. I know it's very noisy, so when you have questions, we can answer that later. My talk is about I want to talk about time, speed and efficiency and new developments in vitrification and warming of oocytes on blastocysts. And my second slide shows you, clinical research on human blastocysts, and on oocytes it's more still research, but you will find more data here at the meeting presented by other groups. I had published both of these recently, as you might follow me on LinkedIn, on RBM Online, on blastocysts and on oocytes. And the next slide just shows you how we traditionally vitrified blastocysts. It took us usually 9 minutes, and now we vitrify blastocysts in 5 minutes. So we do 4 minutes in ES plus 1 minute in VS. And when we come to the warming, our traditional warming protocol needed 11 minutes to warm the blastocysts, and now we are down to 1 minute for warming blastocysts. And here I show you some numbers using Vitrolife media. We fought quite a number of blastocysts, about 90, with an excellent survival. This is a one-step protocol, fought in 1 molar sucrose for 1 minute. And you see how these blastocysts develop after the warming with a nice development in terms of hatching completely or partially. And then I want to show you our numbers from a clinical setting. We have now close to 3,000 transfers. And you see when you go with the positive beta, independent from the age, it's usually consistently over 70%, except for older patients, it's 65%. And when we come to the table that is close to my picture, it shows you the ongoing pregnancy, implantation rate, and finally to take home a baby rate of more than 50% when we use this protocol. So the outcome data are very convincing that this way to force a blastocyst in this very short time is safe. Now I want to come to the oocytes. As you might know, oocyte takes much more longer. It's very time consuming. So the usual procedure is 10 to 15 minutes in the ES solution, then 1 minute in the VS, so a total of 16. And now I cut it down to 2 minutes. I keep them for 1 minute in ES, 1 minute in VS, and then they were vitrified. So from 60 minutes down to 2 minutes. When we look at the warming, we usually warm in 9 minutes. You start with TS for 1 minute, you go in ES for 3 minutes, followed by WS for 5 minutes, and another 1 or 2 minutes in WS. So it comes down to 9 minutes, and my protocol comes down to 2 minutes. I don't start with TS, I use DS, so 0.5 molar, and then I stay for 1 minute, and then for another minute in 2 drops of water solution. So cutting down egg freezing and warming from about 27 minutes down to a total of 4 minutes. I want to show you this is the way most of you might vitrify, and you see how the volume of the oocyte is changing shortly after exposure to ES. It comes down to about a reduction of 60%, so 40% is remaining of the oocyte, and then over time it's regaining the volume. And when you look at the size of the oocyte, the volume, you gain about 80% of the volume back after about 10 minutes. And when you keep another 5 minutes, so there's no change in the volume, it stays at 80 when we plunge them in VS, and you see a drop, another reduction in volume back to 40%. And my protocol shows you similar events, but in just a shorter time. Right? You see also in ES a reduction of the volume, and when we go in VS, you also come down to about 60% loss of the volume. So when you compare the volume, what you achieve after 16 minutes versus 2, it's about 40% of the oocyte, but in a shorter time, you keep the oocyte out to an unnatural temperature, unphysiological conditions, because you do the vitrification at room temperature. So the benefit of a shorter exposure time is also not just a short exposure time, but you reduce the time outside of the incubator for the oocytes. And this is some numbers I did with the Vitrolife medium. That's GV's oocytes, and you see GVs on one side, a consistent survival over 90% as well for metaphase 1 oocytes.
It's the same kit? Or
Same kit, yes. And then you see here some pictures, how they look, right? You know, we almost think they are not vitrified. And then finally, I used the closed system. I think most of you using open system for egg freezing for, the main reason to have a higher cooling rate. But I can show you that the rapid eye in combination with the Vitrolife freezing kit for oocytes works as well. And you see here I vitrified some oocytes, 29 on a closed system. It's a rapid eye. So oocytes stay there because of surface tension on this little hole, and when you warm, you just dip it in the solution and they fall out of this hole. And you see there is a 100% survival even with a closed system. And you see here some oocytes from this, attempt. And that's pretty much. Thank you very much. I'm sure you have questions. We can answer them later. Thank you.
Thank you. Thank you very much for that. We're going to get to some questions after the session. I'm going to pass over now to Professor Freour. Tell us a bit more about your clinical experience, please.
Well, thank you, Yaku. Hi, everyone. Just before I start, I must share with the people connected online that it's a little bit special moment because there are so many people around. I mean, thousands of people, millions of people. So just like Yaku said, there's only Taylor Swift doing better than us. Okay, now I'm going to share with you my experience, my 2-year now experience with rapid warming with the Vitrolife media. So just a little bit of context. I'm the head of the IVF department of the University Hospital of Nantes in France. So it's roughly a middle-sized IVF unit, at least for France. We do more or less 1,400 ovum pickups a year, and we have approximately the same number of frozen blastocyst transfers. And actually, the embryo culture and embryo transfer strategy is 100% blastocyst for every patient, no exception. And we do more or less 95% of single blastocyst transfers. And actually, we culture all our embryos in time-lapse culture because we use the embryoscopes. So, just to remind you, for those who are not familiar with the Vitrolife warming media, here is a short description of conventional warming protocol. It all starts with warm 1 medium for 2 minutes, then moving to warm 2 medium for 3 minutes. All of this is 37 degrees. And then warm 3 from 5 to 10 minutes before moving the embryos to culture medium. So altogether, this is more or less 15 minutes. So now I'm going to share with you the ultra-fast or simplified, as you might wish, warming protocol. So this ultra-fast warming protocol is the same at the very beginning, warm 1 for 2 minutes, and then that's it. Only 2 minutes as compared to 50 minutes with the conventional warming protocol. So it's only warm 1 medium for 2 minutes, and then you move to regular culture medium before embryo transfer. So you save approximately 12-30 minutes as compared to the conventional protocol. So we progressively implemented this simplified ultra-fast warming protocol since 2022. It all started with the first step based on basic experiments, and we used blastocysts donated for research, and we had exactly the same outcome for these blastocysts used for research as compared to conventional protocol in terms of survival, expansion. So we were quite confident with that. And we also did some kind of lineage tracing, or we looked at lineage markers of endoderm, epiblast, and trophectoderm, and they were exactly the same that we were used to have with the conventional protocol. So then we moved to a second step, which was some kind of, let's say, pseudo-randomized clinical study, comparing approximately 50 cycles with the conventional protocol and 50 cycles with the ultra-fast protocol. And then once again, we had exactly the same survival, expansion after 2 hours, and implantation rates. So then we decided to implement the ultra-fast warming protocol in clinical practice, and we closely monitored the outcome, of course, the key performance indicators, and we were very comfortable with that because within the next month, the next weeks, we had exactly the same outcomes once again, and you can see the numbers in details, and hopefully this is going to be published within the next days. So what is the current situation? So we've been using this ultra-fast warming protocol for all the cycles for about 2 years now. So this means more than 2,500 warmed embryos, and we have something like 98.5 survival rate, and our live birth rate per transfer is on average 28.4. So that might look or seem poor to some of you or disappointing, but just as compared to our experience and to the average numbers and outcomes in France and Europe, this is more than acceptable. And beyond pregnancy and live birth rates, of course, we monitored perinatal and obstetrical outcomes, and there was nothing different as compared to what we had before. And in the end, beside clinical outcome, we could, let's say, reorganize and streamline our organization in the lab, because the very short warming protocol allowed us to implement more warming slots per day. So that means more frozen blastocyst transfers that can be organized every day. And this results, of course, in less waiting list for all the patients of the center. So a few comments before I end up with that. First of all, and this is very difficult to quantify, but let me share with you how satisfied my staff is with this new protocol. They would never change and get back to the former historical protocol. It's more flexibility, more comfort. They can be more, let's say, the organization is more smooth and easy on a daily basis. The workflow is better, and actually this allows more activity in the end and more flexibility, and I would say that it's more or less like time-lapse. I mean, time-lapse, it allows more flexibility in the organization on the IVF lab, so fast warming would be more or less the same for people and the staff working in that field. The outcomes, as far as we know at the moment, are at least maintained, and maybe they're getting better or slightly better, but this is, let's say, not validated yet, but at least the outcomes are perfectly stable. And finally, this is, let's say, reinforced by more and more reports by other teams reporting the same encouraging results. And finally, now we are done and extremely comfortable with fast warming of blastocysts. We are trying to set up the same approach for oocytes and also for vitrification that is currently tested in my lab according to Juergen's experience. And that's it. So in conclusion, I would say that rapid blastocyst vitrification and warming is a rapidly growing activity in the lab that is associated with a huge workload. But ultra-fast warming protocol, it does result in excellent and maintained outcome and optimized flexibility and workflow. And in the end, this is better for patients and this is better for the staff. So well, what else can you ask for? And it sets the basis for implementing, let's say, new generation freezing program with optimized, shorter, standardized procedures, and for both oocytes and embryos. And I'm done. Thank you very much.
Thank you very much, Thomas. Any questions that you would like to ask immediately to the panel? No? I've got a question that I want to pose to you, Juergen. Is this the fastest we're going to go? If we look at oocytes and blastocysts, physiology, chemistry, is this it?
For oocytes, yes. For blastocysts, we can be faster without sucrose.
I fully agree. But maybe we shouldn't tell in a Vitrolife meeting.
Yeah,
The,
but
the
you
other-
asked me.
Yeah, fair enough. The other
Is this ultra fast is applicable for blastocyst and omni as well?
I'm sorry, I didn't hear you.
The ultra fast warming, this is applicable for blastocysts and the media for rapid vit and rapid warm omni, or only for blastocysts?
My experience is with warm blast medium, but I guess it can work with omni medium as well. Depends on the kind of sucrose concentration that you use, but of course it can work with both.
Thank you first of all, and I have 3 questions. One, do you puncture the blastocell before you freeze?
No,
No.
No, we don't.
Second,
Never.
Second, do you find any difference with the age of the patient, if
No.
they are young or old?
No.
And
no,
the
no
third
difference
one,
observed.
You convinced me already. Why Vitrolife doesn't change officially the protocol?
All right. Do you want me to give an answer right now?
I have to
I'm
cover my
I'm
back,
gonna be
my
in
shoulders.
trouble. I'm
Yeah,
gonna be
I
in
have-
trouble.
Yeah, I have to have insurance. You
I
see?
think that Juergen is gonna answer you.
Okay.
No.
I'm
No,
happy to short my time. I assume all of us.
No.
But we
But
have
what-
to have it to be efficient.
Well, okay. Then let's share. Maybe we can share that Vitrolife is considering having an official approval for the modified protocols.
You will sell more.
Yeah, those are maybe a question I can't answer you right now, but it's definitely things that we'll be working on as there's more and more validation taking place. Any other questions at the moment?
If the embryos were frozen with a different, like sage or different kind of media,
There's
is it
no
possible?
difference.
No
It
difference.
does work exactly the same.
Exactly the same.
No
Okay.
difference.
Okay.
Because we frequently have some embryos coming from other IVF centers. It doesn't make any difference.
No, sometimes when you freeze oocyte, you vitrify oocyte, the shrinkage is very slow. It depends on the quality of the oocyte. So it's very slow, and then it's came up slower. So how can you avoid this problem?
So the solution I'm using, and I'm sure you use the same, I don't see that. So when I expose the oocytes, is it 6 or 10 to the solution, for example, the ES solution, it takes them like 30 seconds to reach the bottom of the dish. So oocytes in less than a minute in an equilibrium. So there is no need to expose them longer. So we usually maybe, yeah, maybe. But I mean, even you have 10, 9 of them will behave normally. Now it's maybe one who takes longer. I'm not sure if it's a quality criteria. You will freeze it anyway. You might see it when you thaw. It has maybe less chance to survive or doesn't fertilize. But at that moment, you would not take that egg outside of your freezing because of slower reaction to the solutions. You wouldn't. But there is other stuff, what we heard just recently, AI, where we look at cumulus, make predictions based on cumulus, on oocyte quality. So this will help for egg freezers that you have information on the oocyte before you freeze it. And then you can say, I will exclude it or include it in the freezing.
Great. Thank you very much, gentlemen. Lovely
you,
topic.
Jakob.
If you have more questions, please feel free to ask it afterwards. But join us for the next session, which will be in about 10 minutes' time. Thank you.